So good afternoon. This is the last panel for today. And we're very happy, I'm very honorable to present my panel participant who will, of course, tell about themselves. So please, you're welcome. So at this hour that we have, we're going to discuss the post-pandemic challenges, the new normal, and evolving scenarios in healthcare. We have all convened here to debate and discuss the recent trends and advancement in the field of healthcare after 2 years of the COVID pandemic. Since you are all aware of the unprecedented challenges that the healthcare system of the world is facing, the world has been put on a halt by a virus that cannot be seen in the naked eye. It had raised questions about how and where to proceed from here. Everyone in every continent is dealing with the urgent needs of this public health crisis and outcomes, of course. And we have learned so much in this conference, and thank you so much, the management of Health 2.0. And we need to implement more changes in all our health system in the future. So here with me are to discuss honorable member of the panel. They will introduce themselves, and then I will introduce myself too. So please.
Hi there, my name is Lana Phillips and I'm the CEO of Helpful Hemp, and we are a 100% organic CBD company. I know, speaking from personal experience, bridging the gap between CBD and modern medicine, well, there is quite a gap. I think I'm finished? I don't know how I want to figure out a way to bridge that gap, and I don't know yet, and hopefully the people here at this conference can help me figure out a way to do that.
Hi everyone, my name is Rashmi Joshi. I'm the founder and CEO of Asha Care. Asha Care is essentially a fully voice-enabled remote care solution that helps the elderly population to age in place while keeping their loved ones informed on what's happening with their health behind the scenes. I'm really excited to be here today alongside some really wonderful panelists. And thank you, Eddie, for being our moderator.
Thank you.
Hello, everyone. I am Xavier Mcgillberry. I'm the Executive Vice President for Home Care Network. We are a home health company that handle all clinical needs in the home. And with the COVID surge, we have become busy. We look forward to building some partnerships because that's what it's going to take to move forward in healthcare. Thank you.
My name is Dr. Wolfgang Scheinhardt, and I'm the founder and CEO of Geneva Health. We're located in the San Francisco Bay Area, and my focus on our clinic is a holistic approach, and it's very focused around bioenergetics. I know this is a topic that we're probably not going to be able to cover here in this panel, but basically we take a 360 round view of a person's, especially around their energetic distortions and information distortions that exist within their field. So it has a lot to do with quantum physics also. As I said, this is a topic for another day, but the point is really that we take a very holistic view, and I think as far as the pandemic is concerned, we have been doing telehealth even before the pandemic started, so we have a lot of experience in a lot of the approaches that we take in a remote way.
Thank you so much. So my name is Eti Rosenberg, and I came all the way from Israel to here. I'm head of innovation in nursing for the largest health organization in Israel. This is Clalit Health Services. In Clalit, we have 14,000 nurses. We have close to 5 million people insured in 14 hospitals and 8 district communities. And I was mostly in leadership roles. I was the chief executive nurse of one of the largest hospitals in Israel, and then for one of the largest districts in Israel. Currently working on health policy, innovation, and development. And last year I was elected the only one from Israel to the WHO list of women nurses of the year. So this is my honor to welcome you all. And we're going to discuss actually the practical elements of changing what happened in the last 2 years into early next future. And we heard some parts of it today, but we're going to deeper right now in our session. And I really want to ask you, how has this pandemic changes the healthcare domain from this time from a patient or a client point of view and their expectations? We spoke a lot about the providers, but this time try to see it from the point of the client and the patient. Who would like to begin? Thank you.
Start.
Sure.
So it was very interesting as we entered the early stages of the pandemic and the lockdown situation in particular, because of course, like other people already related to that fact that clients didn't want to come to the office for safety reasons and so on. But as I said, we do a lot of remote telehealth applications already. But I think the key was it changed a lot in what clients were looking for. So it wasn't specifically what can I do about COVID, but what can I do in general to improve my overall health. That was probably not a sentiment among the entire population, but at least a lot of clients came to us and said, I want to see how can I improve my immune system, how can I improve my overall well-being, so that I might actually be better prepared for what happens with the virus situation, right? And I think even till this day, I think this is a missed opportunity, in my opinion, from a public health point of view, because we heard a lot about statistics of mortalities and other things, but there was never any talk about what can we do to improve the overall health or well-being among the entire population. And I think this is a key, of course, in our attempt to deal with a situation like this, where many had asymptomatic symptoms even in the very beginning, and this was never really picked up on, in my opinion. So anyway, so that was the beginning, and so we had a lot of them coming in and saying, okay, what can we do? And it was a perfect match from our point of view, because we take a look at a holistic view, so we don't compartmentalize between there's a person with with mental health issues, or it's only physical issues. The technology that we're able to use in our clinic allows us to take a look at all of it. And I can tell you it's often has to do with toxins, heavy metal exposure, radiation, EMF, and so on. And then, of course, a big component, especially with chronic situations, which is what we mostly deal with, oft complex, multi-layered disease patterns, is past shock and trauma. I didn't hear this at all so far in the conference, but this has a lot to do with chronic issues that people develop, and that can start mental health, it can start in your physiology. It doesn't really matter. Eventually, it's going to affect your entire body. And so we really started to tap into this need that clients had. And the fact was that since we could do this remotely, essentially it's like a little mouse device. You can connect via USB or via your smartphone. It takes 10 seconds, and we do get an assessment on where you stand with your overall health in regards to energy levels, toxin levels, heavy metals, and even past shock and trauma events. So that was, I think, a very early need, and then later on it developed more into, okay, I like this, yeah, so how can I keep going, right? And so we developed from this early stage of responding to this need to almost more of a preventive care model, right, eventually. And so we continue to do this on an ongoing basis, and this is what we have been really focusing on, that rather than what do we need to do specifically about the virus or the COVID situation, what can we do in overall to improve someone's health? And that's kind of what the model is, and I think people really responded well to that approach.
Thank you so much. And it's so interesting what you're saying from two points that I'd like to emphasize of what you said. First of all, the post-trauma. It's true, we didn't discuss it today, and this is some outcome we all have. We talked about burnout and stress, but post-trauma. And the other thing is people didn't come for their annual checks, and they missed appointments, and it had an effect on their health. Thank you so much. Who would like to? Yes, please, Lana.
To add on that even further, I can't call them patients because I'm a CBD company. I have to call them customers. The added difficulty of getting to see a medical provider. The kids are at home. Everyone is consolidating. They're losing their jobs or moving in together. To have the availability to go and see a medical practitioner, and on top of that, finding a medical practitioner that they trust. That has been a huge obstacle for me. And I have medical insurance and I can afford my co-pays. You're adding in all of these different obstacles that without telehealth, we're not going to be able to help people improve their quality of life.
Thank you so much for bringing the kids' point of view and mothers and fathers and families. Thank you so much. Yes.
From a home health perspective, I think that it put a lot of emphasis on the lack of resources in communities with less resources. I think that it put emphasis on the value of communications from the different levels, from all levels. I think now that we know we need each other in order to get great outcomes, I think this COVID sort of made us realize like communication is important. I think the dynamic of we can't find balance between telephonic, video, and in person so that a person has more care to receive better outcomes. I think that was a big emphasis that this pandemic put on us.
I completely agree with you. We found out many ways of communication, but it seems like we can't really use just one of them, right? Yes.
Well, now that I'm done coughing up a storm, I'm back. I might still be coughing, so sorry about that in advance.
That's okay.
I think the biggest difference that we've seen through the pandemic is the access to care, right? Digital therapeutics, telehealth, virtual visits weren't really a reality until we went through the pandemic in the last 2 years. And while that also afforded access to care to a lot of populations that otherwise wouldn't have had that access, I'm talking about, social determinants of health, rural parts of the country where people lack access to hospital ecosystems. There's a lot of good that came out of how we've adapted through the pandemic. But despite that, there are also still some challenges on the horizon. The biggest one that I think a lot of people spoke about earlier today was caregiver and care team burden. Our hospital ecosystems have so much stress on them right now and have had that stress over the course of the last 2 years. And despite this host of digital technologies that we have on the market today, what we've learned is that the social fabric and the ecosystem needs to adapt alongside it. So there's a lot of room for improvement. There's also different ways that we can work together, as Xavier said, for us to actually create an ecosystem that functions well together and functions more cohesively. And I think part of the way we do that is being able to openly exchange healthcare data while still being mindful of privacy policies and HIPAA regulations. And thanks to new technologies on the market in that realm, we're finally in a place where we can start consolidating and sharing access to health data in ways that can really, really, truly impact and benefit people's lives long term. So I'm really looking forward to seeing how that goes over the course of the next few years and hopefully being a part of the solution.
Thank you so much. So you said, in summarize, that access to health is so important, and thank you for mentioning the determinant and the ethics part of who gets to access to health. Thank you so much. So we're going to ask now, what are some of the new healthcare scenarios that will remain after the pandemic, and we're not done yet, of course, or have emerged because of the pandemic, and you said some of them so far, and you think that should be addressed going further, much deeper this time, and what's going to be here in the 2025? Who will go first?
I'll let somebody else
Sure,
start.
please.
So, well, I think the first part is what we just touched on a minute ago, which is being able to openly exchange health data across different organizations, across patients, and also maintaining access controls and privacy. I'm hoping that in the next few years we can tackle that, and there have been some major advancements in that space thanks to digital health. The other thing that I think is going to be a massive impact on how we actually care for each other and how we look at healthcare is a shift to preventative health. So instead of looking at just treating, we can use tools like AI-based solutions on the market, including ours, to actually prevent decline in people who are experiencing chronic conditions. And we can do that through monitoring, we can do that through access to care, and we can also do that through being able to prevent different declining health events by making sure that the care plan is being managed appropriately. What's happened right now is that we have very little access into how care is actually being managed at home. When your doctor hands you these 3 pills and you take them home, no one knows if you actually take them. No one knows if you take them exactly when you're supposed to take them. And furthermore, we don't know if that care plan is actually giving you the provided results that you're looking for. So being able to create essentially a feedback loop, I think will be really, really beneficial and something we can look for in the next 5 to 10 years.
Thank you so much. This is so true, and I was thinking about the word that really described what you said. It's prevention, and this goes really great after the inspiration lecture that we had before of how we move from treating disease to prevention. Thank you so much. Yes, please.
And then,
Lana.
if some people have been monitoring the cannabis industry, it's not just the pandemic. The pandemic just happened to happen at the same time. We need to figure out a way to help people manage cannabis-based choices, but also to be able to communicate with their medical providers. This is what I'm doing for this reason, and can you support me? And by the way, I'm not anticipating anyone in this room is going to find a solution today. These are things that legislation is going to have to help facilitate, and the FDA will have to help facilitate. But I know for people like me, I can't do opioid-based pain medication. My parents lost custody of me by the time I was 8 years old because of drugs. I won't touch it, I can't do it. And people like me need to be able to go to a doctor and be like, I need a solution for this, but I can't do this pain management. There has to be a bridge somewhere. I don't know where, but I know that that needs to happen for the patient to come to the doctor to be able to get the health care that they need.
Thank you so much for this authentic voice of yours that really portrays the fact that we can't really move and finish with all the face-to-face appointments and being there for the patient in the most physical way. Thank you so much. Yes, please.
I think the dynamic of the care in the home, it grew over this pandemic, and with the overpopulated hospitals, I don't think that's going anywhere with the dynamic of the baby boomers. I think that this is going to be the new way. You have now where hospitals are creating the hospital to home, you have the remote monitoring. So I think that dynamic is here to stay, and it's just going to grow. And I think to piggyback off what you said, it's also going to be a great dynamic for preventative care. It's going to catch a lot of things before they get bad, and we're going to cut down on rehospitalization through this program.
Thank you so much. I think what you're saying is that for the last 10 or 15 years, we were trying to push hospitals at home, but we didn't really make it until the pandemic. Once the pandemic hit us, we had no way of doing it differently because most of the patients were at home from the COVID perspective, of course. So I agree with you that this is the trend that's going to be, and hospitals will implement hospital at homes for the better of the patient. Thank you so much.
Well, I want to pick up on preventive care also because there was a lot of talk here, but I think it's important. I see three things. First, I think we have to have a change of heart also, every one of us, to move away from the fixed patch attitude that a lot of people still have, that if I got a health problem, it's not my problem, it's the doctor's problem, right? I just go there and I hope they fix it for me. And I think the realization also during the pandemic was that network may not always be there, and I may not have all the care all the times, and I actually need to do something about my own situation. And so I think it's a wake-up call for all of us to realize that we own our body and we own the health as well. Now, we do need some help and support, of course, from professional experts and others, but I think we cannot just shift that responsibility away from us and just make it someone else's. I think it has not served us, and at least in chronic situations, we know that that's really not a successful model. I think the other problem we face is insurance companies, because at this point, and especially during the pandemic, I think there was a large uptake on the idea of other alternative ways, methods, therapy modalities that are out there. They are proven as far as their applicability is, but they're maybe not approved, by insurance companies, or maybe seen from a more traditional medicine approach as not applicable, or just not respected or accepted. But I think there has to be a system where insurance companies need to have that attitude that if we do want to do preventive care, we have to allow for these methods at least to come in and prove themselves, with surveys of how well it is doing for clients, right, and so forth. So I think that has to change too, and it had to be in the interest of insurance companies to get into that preventive mode so we don't have large expenditures on the end of it, which is where we do a sick care rather than a health care. And I think the third aspect is that all the application developers out there, I can only encourage, please take a look at, come up with industry standards, because if you create 15 different devices and you hand this over to, let's say, a more advanced aged person, it's not going to fly. It's just not. I mean, I do this for many years now. I have to get involved with even computer illiterate people, right? They touch the computer maybe once or twice a month, and then teaching them on how to download applications, how to connect devices, upload data, and so on. And then every single one of them has a different way of doing it. I think we have to get past that. So that would, of course, be a challenge for application developers to come up with a way where you still allow an individual representation of the data, but as far as the devices providing data and connecting to it, there has to be a better way, a uniform way of doing this. And last but not least, I think the preventive care requires also the understanding of the approach we take from a Western point of view. And I'm glad I heard lots of other speakers before this panel to say lifestyle changes, life balance changes, stress management. These are all good things, and collectively, essentially, you reach a preventive care model. Yeah, that's what I would like to say.
Thank you so much. What I take from your message is that change of heart, which means we own our health more than ever. And I'd like to remind you all that we used to go to work even if we had a little fever, a little throat pain. I remember giving my kid a medication, just some Tylenol right before kindergarten, and let them be okay, because I can't miss a day of work. And what happened in this pandemic, that we all learned that it is okay to miss work, to miss day of work, and some of us work remotely from then. And also everybody was sick and you didn't want to infect anyone, so you did stay at home with no excuses. It was eventually, for the first time ever, it was normal to get sick from time to time. And that's part of the change of heart and owning our own health. Thank you so much. I want to ask you all, what other factor or how healthcare is provided to patients or clients should be addressed or need focus in the near and long term? That goes from a different angle on the same topic, please.
Well, I think it adds a little bit to what I already said. You know, some changes within the insurance model, changes to the application of devices. And the other problem is, of course, how do you quantify, I'm in the alternative healthcare space, how do you quantify things that don't seem to fit the model that is used by Western medicine methods on efficacy, right? So I think we have to be more willing to accept also a client experience, and at least as far as much assessment one can do as to their health state, to allow that also as a proof model of something that works. And we have talked about several other things, some of the presenters today. So I think I would like to get to from an excluding model to an including model, right? And rather give many things a thought before we rule it out. And I think that would be something that I would like to see as we move forward, to take that opportunity that we had throughout this pandemic to be more open to other ideas, other modalities. And nothing replaces one with the other, but I think there can be a complementary way, and achieving that complementary way ultimately will serve us all in our health and well-being state.
Thank you so much. We really had these past 2 years an elastic minds, because a pandemic is an evolving event that changes from month to month, from different things to different things. So I think we are ready for what you said, get open-minded in terms of providers and patients and everything. Thank you so much. Yes, please.
I think what I would like to see more is community education. I think in order for it to be successful, it has to be an understanding in the community. And these communities are not cookie cut, so it's not one shoe fit all. So what I would like to see is more health system getting involved in the communities that they are in and educating, and I think you'll get a better response from the patients and have an understanding to where whatever we deliver to the community, they have an understanding and be able to follow the plan of care, whatever we need to be successful.
Thank you so much. Communication, education. This is an amazing topic that we really should develop. Thank you so much. Yes, please.
So I think one of the low-hanging fruit that we can tackle even now, which many of us haven't yet, is trying to find a user interface that actually is easy to use. We have so many different digital apps and tools and technologies. We've got tablets galore, and nobody wants to use them. They're too difficult to figure out. They might be easy for someone who works in technology or is tech savvy to figure out how to use. And even then, after playing with it for a couple of months, you're going to throw it in the trash or re-gift it to someone else because it's not worth your time to engage. So one of the things that I think we can do in the near term is create a user experience and a user journey and an interface that's really engaging, that feels intuitive, and that's something people actually want to use. And that's one of the core things that we focus on with Asha, and I continue to use us as an example, but you know, it's the thing I'm most familiar with, so you'll have to excuse me. But one of the things we focused on when we were building Asha was creating a user interface that is easily accessible to the elderly population. Because if that's who we're targeting people who might have problems with their vision, with mobility, with hearing loss, and are not going to figure out how to tap on that tiny little red button there to figure out how to get in touch with their doctor. And so one of the things that I think we can expect to see in the near term is a lot of these technologies that are on the market today need to adapt and to evolve into a seamless user experience that people are excited to use every day. Because until we do that, being able to, create a cyclical ecosystem of healthcare, it's just not going to work. If you don't have something that people don't want to use every day, it doesn't become ingrained in part of their daily existence. And then they're only reaching out to it when they have something like a fall happen, when they're having cardiac arrest, when they have a stroke. So instead of trying to retroactively go back and manage and treat, what we need to do is create technology that serves people in the first place and can help prevent episodes like that.
Thank you so much. Yes, please.
Combining the two thoughts of the technology versus outreach to the community, we need more doctors to step up, to be willing to put their faces out on social media, because there are patients, and this has been my experience with healthcare, I will find a doctor and I didn't vibe. They either didn't have the time to listen to me, or I wasn't able to communicate effectively with them. I don't know what it was, but I would have to find other healthcare providers until I finally found the one that worked. And when we're now seeing doctors are posting on YouTube and Instagram, and they're doing the shorts, and they're addressing things, common myths, health prevention, and they're doing that, and patients are going and finding them and being like, I want you as my doctor, because I know that you know that I know what this is, that whatever the post was about. And if we can get these doctors like, oh, hey, you're in this area in Sacramento or Las Vegas, like this doctor that knows this is here, then these patients can go to find the doctors that they need in their area because they recognize them and they see them, and they're going through channels of social media that's easily accessible, easy to use, everyone knows where it is. If we can get doctors to be a bit more transparent with their patients and I get it, I know how hard doctors work and how much all of our day-to-day time is, but it would really, really serve patients to be able to connect with their doctors outside of the hospital room.
Thank you so much. So much has been said in this answering for the question, and I really think what you all expressed is how technology is going on very fast, but are we there to make sure we have the right answer for the right people? Because what we can see is technology was very good with the young adult and of course the kids, but it's not exactly what we need for the elderly and for the people with disabilities. So I see what we're trying to understand here is the balance between moving ahead with technology, but still are there in person with a personal touch in healthcare. As we are getting to the end of the panel, I really would like you to share whatever you think in your thoughts as your final remarks. Please do.
Well, first of all, I appreciate the opportunity to be here at Health 2.0. This is my first time being here. I don't even know if it happened before or not, but what I, of course, wish is larger attendance, more interest, and also I think hopefully getting more input on other ways of how we approach this whole topic, and hopefully covering all aspects. So from a technology point of view, from an educational point of view, from the actual practice, how we engage with clients. So there's a whole bunch of topics, and hopefully we get some more coverage and some broad ideas that are maybe a little bit more out of the box. So some of it we saw, but I think there could be more. And I think the working together, sharing these informations as to what each of us experiences can help us to just build a better healthcare network that will serve the overall population.
Thank you so much. I think being in this conference, we understand how the challenges are so similar, but sharing them is really making us all stronger with where we should go Thank you so much.
I think what I would like to see more is transparency as far as not being afraid to say what you don't know, and to build relationships with people in other domains so that we can bridge the gap. I think sometimes we feel like we're afraid to say we don't know, and I think once we open up about that, we could bridge the gap to have better outcomes. If I'm not a tech-savvy person, let me connect with someone that is tech-savvy and see how we can help this patient. For instance, I'm a home health guy. It's going into the home. So, you know, we've been in business for over 25 years. It's hard to come if you just get into the home in 2 years and see what we've seen. But yet, if you educate me on the technology like you did, we can bridge the gap and patients are rewarded. So just be transparent and don't be afraid to say, I don't know.
That's a great advice for everyone. Thank you so much. Yes, please.
Thanks to being able to, being able to actually use different kinds of APIs to get more hard data about how people are managing their care at home. Being able to tie in caregivers. Some of the other services that are not technology-based, like laundry, meal planning, transportation to care, all of these things that we don't necessarily today consider as healthcare, but are still really impactful to the health of each person. So building not just technology and not just a service industry offering, but being able to put together an ecosystem and a community around that essentially serves itself and creates this systemic long-term change, I think is a direction that I'd really like to see us heading in over the course of the next few years. And I'm really thrilled to be here. I'm really thrilled to see all of you in the audience here, and I've met a lot of you, and you're working on some really incredible things. And I'm looking forward to being able to work together to create that change. Thank you.
Thank you so much. Your remarks about community, about seeing people as a whole, not just in part, is so important. This is why we come here and connect with each other to make a better world. Thank you so much. Please.
Maybe this is just because I'm really young and I like things to be done really fast. But all these things that we're seeing that we know that's going to be around in a year, 3 years, 5 years, we need to hit that fast forward button because there are people that need help now. And it's really cool to see that there are people here on this panel, people here in this audience that are moving in the right direction. I don't know how to speed up that time frame and hit the fast forward button, but if there's a way that we can, we should.
Thank you so much for this authentic voice of yours and saying we don't have time to plan so much. Let's move it. At this point, we conclude our panel. I want to thank the audience and, of course, my honorable member of the panel for participation. I've learned so much from you at this hour, and I hope we could share knowledge in the future together. I want to thank Health 2.0 for this conference and the panel, and see you next time, of course. Thank you so much. We still have some time for questions from the audience, if you have, please.
I have actually one question. Is it possible to agree all on actually depoliticizing how we handle pandemics? That's my first introduction to the question. The question is, so far there has been many experiences in different societies and different countries, with different approaches. How much did we learn from that? How much did we apply from that? Israel, for example, has a very special experiment. And I don't see many people learning from that, many societies learning from that, or at least discussing it. Can we do that?
That's a big question, and it's great for the end of the day. Please.
May I? No.
No, we
I
cannot.
don't think we will. I think there's certain smaller lessons that we've learned about how to handle a pandemic and what things we can do to, it's essentially treating a pandemic. But in terms of actually preventing that from happening, I think that requires a lot more deep thinking. It requires infrastructure and systemic change within how our healthcare ecosystem functions today. And until we actually make that happen, we can't really go back and learn from our mistakes because we're creatures of habit. We keep making the same mistakes over and over again. And I think it's really fun to think, oh yeah, we'll be much better prepared next time. But the reality is we probably won't know next time around how that pandemic is going to go either. There will be new challenges. It'll take us longer to figure out perhaps what's actually causing different kinds of symptoms and to come up with a vaccine. These challenges, I think, will come across no matter the health incident that happens in the future, because it's biologically driven and because that's something that we can't control. What we can't control is how we actually handle it. So I think we can take some of these lessons from COVID and apply that in the future. But I don't think we'll ever be in a position where we can prevent this from happening moving forward. It's just a reality of the time that we're living in.
How about-
You got some honest answer here. Yes, please.
No, I want to add to this. I think the challenge also is that we do have different social and economic environments. And you take, for example, Sweden, which took a very different approach to
Yep.
how they handled
Yes.
the pandemic. Israel, another example, right? But you have to also look at, okay, what was the healthcare system in the first place? How healthy are people over there in general? What is their life balance, right? Are they stressed out from work, or are they more relaxed as people in the US? Yeah? So I think these factors also come into play when you have to consider how do you respond to a pandemic from an overall approach, not just only from a healthcare approach. Because, you know, we could be in a lockdown for 2 years, which of course is ideal from a healthcare perspective, but economically speaking, I think that's certainly not something we would want to do. So I think there's a balance between other factors that come into play besides just the good things that we were supposed to do to keep us healthy.
Okay.
Thank you so much. Anyone else want to add something?
About politics, absolutely not.
You can't finish it without
Not
politics.
really,
Yes. Thank you for the big question, which makes us all wonder. And thank you again for participating in the panel. Have a great day.